Do you see us?
Yes, I do.
Okay.
Yes, on Facebook
This isn't
Live. Yep.
bad. This isn't bad because it's 3:01 and it's saying we are live. So I see there were some comments coming in. Okay, sorry that we got booted out, everybody. I see some people are jumping on. Hello, Dominique. Now we're back. I don't know if there was that break, but it is on. It is running. Um, okay. So here we are. Hopefully we won't get kicked off again. I can see people are jumping on. We were on a few minutes ago, and this is why I'm testing early is because we've been having problems with Facebook Live every month for the last few months. Let's just hope we can get through. The only time it's not a problem is when I'm in person. And of course, I was supposed to be. So hi, everybody that's on. As I said before, and sorry we got booted off, but we're on and we're live, and I see people are joining us. It's Dr. Linda from the VBF here this month with Dr. Duarte from Nicklaus Children's Hospital in Miami. I was supposed to be down there for her annual VBARS, Vascular Birthmarks, Anomalies, and Related Syndromes conference, but unfortunately my flights were canceled one right after the other due to inclement and freezing cold weather in the Northeast. So anyways, yes, you are climbing and tell me all where you are from, say hello. Dr. Duarte is here to answer any questions related to vascular birthmarks. Kiana, if you're on, can you please uh, put a message that says you're on? I can see, yes, I see it says the VBF logo is there. Let me see some comments so that I know you guys are all seeing us. I see you're on. Can you please put some, let me see them, go back out. All right. Okay. So Kiana, you do see us? And can you type a question? Because we had the other section that got cut off. I need one of you to just type a question in the comment section so I can see that we are connected to the comments as well. Because this is our second time popping back on. And we are live, so I can see that. Why is it going back? It's going back to I don't know. I'm not seeing the comments in here either. I am looking at it from my phone. So it's showing us on here. Let me go back out. I'm going to go back out and come in and see if this is us. I don't know. I think it might be the other one. This was 10 minutes ago.
I had us I had us on my phone, but I don't see us on right now.
You don't see us on the phone? Go back
No.
out and go back in. Um, I see us.
Oh
Okay.
no, now I do.
Oh, here they
Yeah.
are. Okay.
Yeah.
Oh, good. Phew. I see you guys. All right. So now it's populating on my phone. Yes, thank you. This has been this. Oh, thank you. Hi, Debbie. Hi, everybody. Well, at least you're showing up on my phone and you guys can see us. So yeah, thank you for whatever's going on with electronics. Hi, Dominique. Dr. Duarte treated me as a 1-year-old until I was 12 years old. I'm now 28. That's Dominique Elg, ELG. She's saying hi to you,
Hi.
Duarte. And Rihanna is on. Hi, Sylvia. Tracy. Hi, Tracy. We're here with Dr. Duarte, ready to take any of your questions. Let us know where you're from. And then you can ask any question regarding vascular birthmarks. See, it's a good thing I started like 5 minutes early because we got on, we got booted off, and then we got back on again. But at any time between now and 4 o'clock, when we end the session, you can ask your questions live. Anything related to treating an infantile hemangioma, a port wine, a vascular birthmark. Hello, Sylvia. She's in from Bulgaria. Tracy, hi. Again, let us know where you're from and we can start taking your questions now.
And this year, I think you mentioned that we were actually going to take questions about all different types of birthmarks, right, Linda?
Yes,
So,
yes. So whether
all
they're
birthmarks.
right, vascular or non-vascular. So any birthmark, black, blue, pink, red, white, goes along with my new book that's out. Birthmarks are like flowers. If you haven't seen it, I don't know why I'm not seeing myself show my book, but I guess there might be a delay. Yeah, anyway, so there I am showing my book. So, my book, Birthmarks Are Like Flowers, is about all 5 birthmark types: brown, blue, pink, red, and white, even white, vitiligo. So, oh, hi,
We
hi.
even have we even have yellow. Yellow.
That's right. I forgot about that. Oh, Dominique is going to see you tomorrow at the free clinic, to the one who was
I'm
your
looking forward to
patient
that.
when she was young. That's awesome. Hi, Sylvia. Hi, Sarah. Hi, Juliana. Hi, Sergey. Sergey, glad to see you, Sergey. Sorry, I'm missing you and the whole team. So is the new Candela Laser V-Beam Pro released officially in Europe, Dr. Duarte?
In Europe, no, I don't know about Europe. It's not officially released in the United States at this point, but we're excited. I think we're getting much closer. The reason that they had slowed that down or paused that is there were a lot of issues with the laser, and Candela is an amazing company and they really wanted to do this right. And so they paused that, reevaluated that. I know Dr. Geronimus was really spearheading that whole effort to make sure that that laser really worked in the right way and that was safe and effective. And the relaunch is going to happen soon, and we're all really, really excited about that.
And you were there, Dr. Duarte, when Dr. G
Yes.
was testing the Pro, and we have been getting phenomenal feedback. We had a man wrote to me today, and he hasn't had a treatment in 16 years because they were so painful. And he said to Dr. G, I want to try it without a nerve block with just a cream. And he couldn't believe it didn't bother him at all, he said it was like unbelievable. Like he said, on a scale of 1 to 10, it was like a 2.5, where other people are saying it's like a 3, maybe. But before, other people were saying it was like 7 or 8 or something. So I'm ecstatic. And we know now there's only 4 test models in the US right now. And like Dr. Duarte said, it'll be a while before they do the official launch. But until
But
it's
we're getting closer. We're getting closer.
right.
We're excited. We're really excited to have that launch, and looking forward to this advance because I think the V-Beam Perfecta and Dr. Stuart Nelson, I think, also would back me on this, is that we think it's a great laser. What we have now is great, but it's been a long time in coming to get to the next level of technology. And again, this was released, but it wasn't exactly where the company felt it should be. And so, in good faith, they put a pause on it, and now we're relaunching it so very soon. Again, like I was there in October with Dr. Geronimus doing a lot of different treatments to make sure that everything is just right and that the laser is safe and reliable, which is what we want. So we're all in the laser community very excited for this release
So there's a couple people who
soon.
are excited about the clinic tomorrow, and they want to know, which lasers do you have and what can they expect from their free treatment?
So I use the V-Beam Perfecta, which I think is a great laser. It's been shown to be safe and effective. Um, so that's the laser that I'll be using tomorrow. I also have an Alexandrite, but I don't use that very frequently in lasers for port wine stains. Um, I haven't seen that it gives me any better results than the V-Beam Perfecta. The V-Beam Perfecta has different energies. It has only one wavelength with this 595, but it also has different pulse duration. So there's a lot of things that you can do to make the laser more effective. And depending on the skin type and the depth and the size of the vessel in the capillary malformation, we can make adjustments so that we can get what we call, very targeted treatment, which is what we want without getting a lot of blistering or, increasing any risk of scabbing, which can lead to some post-inflammatory change or even scarring. So that's the laser that I'll be using tomorrow, which is the V-Beam Perfecta. Um, I find it to be very, very effective and also user friendly. It does hurt a little bit, but it's not unbearable.
And what about, one of the moms wants to know where there be swelling, what aftercare is there?
So with these lesions treated with the laser, there's going to be a little bit of bruising, a little bit to a lot of bruising, depending on the lesion and how well it absorbs the laser light. Um, there can be minimal scabbing, very minimal. There can be some swelling, especially if we're going to treat around the eye area. The treatments are quick. That's the good thing, depending on the surface area, but even a larger lesion, you're looking at 15, 20 minutes maximum. But a small lesion can take, under a minute on the order of seconds. So it really will depend. But we do these all the time in the office, and the patients are happy, generally very happy with their improvement.
So you don't use anesthesia in your office?
So we do in some older patients, but in general, the topical anesthesia for infants is not approved. And there can be a significant amount of absorption, which is unpredictable. The treatments are so quick that I feel like most of the crying that you get with the babies especially is because they're going to cry regardless because you're holding them down. So you're seeing the minute you start to restrain them, they start to cry. So we use in my opinion, a very user-friendly approach to restraining the baby where we will show you tomorrow how you're going to help us hold your child. And I feel like by the parents holding the child during the procedure, in addition to my staff, which is trained to help secure the baby so we're all safe. You'll find it that the children will feel more comfortable and will get through the procedure quite easily.
Thank you for that. And this is exciting. So Jenny writes that her son, Bo, wants to know how long after treatment the area is painful. But that's not what's exciting. What's exciting is he hasn't had laser in a long time, and he decided to try it again. So he's stepping outside of his comfort zone, which is great. And he doesn't remember treatment. So he just wants to know, will the area be painful after it's done?
So the laser treatment itself is somewhat painful, but afterwards, most patients don't feel too much discomfort, maybe just a little Tylenol. And if anyone coming tomorrow want to take a little Tylenol before you come in, that would be great. I would stay away from any NSAIDs such as Advil or ibuprofen because it can lead to a little bit more bleeding, so more bruising. So if anyone wanted to, you could take a little bit of Tylenol before coming in. But again, it's generally well tolerated. It's a quick procedure. And the laser itself has what's called a DCD, which is a dynamic cooling device. So it's going to shoot out a little cold liquid. It's just instantaneous with the laser pulse, and this is going to help remove any kind of sting. Again, most of the crying that we're going to get from the smaller kids is because of anxiety, and which is normal and to be expected. It is uncomfortable. Any parent that wants, I can do a test pulse on them so they can see what it feels like, and it feels like a rubber band kind of stinging you. And again, there's that DCD, which was already in advance that is in the V-Beam Perfecta. Now the Prima, the Pro as it's being relaunched, has a before spray and an after spray. So it's going to spray at the time of the pulse and then another spray. So it's like, I think that's what really helps with the pain management. And that's a technology that Candela has in their hair removal laser. So it sprays with the pulse and then, well, right immediately timed with the pulsive laser and then right afterwards.
Yeah, I remember being with the laser guidelines team at Candela headquarters, and I'm like, why aren't you guys doing Cool Zap Cool instead of Zap Cool? And then Roy's like, I'm doing Cool Zap Cool. So they're all doing the Cool Zap Cool now, which is logical. It makes sense,
Yeah.
right?
Yeah.
But see, there was old theory that it, and Roy and I talked about this. The old theory was if you cooled it before, you would constrict the capillaries and not get a good result. But that's not true because Roy is doing it and getting great results. So this
That's a good point.
means
Yeah.
yeah, I think the comfort is so much better for the patients doing it this way. Just so much better. And like you said, you can do it on the mom's arm and let the mom feel it or the kid, just to see what it's going to be like. Um, the next question was this is for me. She wants to know which laser will be used at the free clinic in Milan. He also has the Perfecta, the same as Dr. Duarte. I am trying to get Candela to bring a Prima to the Milan clinic because there apparently there's a couple Primas in Europe that are still working, and it is a good laser. They just, like Dr. Duarte said, had to work some of the bugs out. But I see a lot of people that are on. Hi, Melina. Hi, Sina. Hi, Amy. Hi, Jamie. Hi, Cece. Hi, Irene. Please ask your questions now. We only have Dr. Duarte for 45 more minutes. It's, oh, well, less than that. It's almost 3:20. And she's here right now. She's ready and willing to answer your questions. One question that was brought up, it's a bit controversial with my doctors, but it's on this photodynamic therapy, that PDT. I know that Roy and Stuart and Henry Chan, many of the experts, they're not like um, they're not using it. In other words, they're
No.
waiting for things to kind of improve with it. What is you have you do you have any thoughts about the PDT?
So I know there's a lot of work with the PDT and the laser in China, and we are waiting to see on some of those results. I was actually consulted to see if I wanted to participate as one of the study centers for that. But at the time, I wasn't able to take on additional studies, but it looks exciting. There are clearly, since you have to inject the Levulon or the porphyrin, it induces a condition that's like a temporary porphyria. Um, and so you become very photosensitive, but that's good because then they target the Levulon or the porphyrin inside the lesion. But it's not 100% going there. There will be some possible systemic side effects. And so, we still have a lot to work out on that. In China, though, they have published some studies that are very promising. We're always looking for better solutions than what we have. But yeah, it's not FDA approved yet, and I think it's going to be a little while. But there are some ongoing studies now in the United States. Again, I wasn't able to participate, so even if I had been, I don't think I could say too much because it would still be under study. But it's there are things that are being tried, and we look forward to the results and see how it goes.
Yeah, I know that there's like you said, there's a lot of studies out of China, and those are with adults. Do you know
Yes.
if they are they're using it on children yet? Because there was a big concern about that it wouldn't be able to be used on children.
Yeah, children are always last, and that's the way that the study algorithms go. They start with the 18 and above and then down to age 12. And I do believe this was 18 and above, which was also something that was a little limiting for me because although I do see adults, the great majority of my patients that have malformations are, in the teen years. So most of them would not qualify age-wise. But, the second tier will be down to age 12. But I do believe it's still only in adults. Yeah.
Okay, so then the second rung would be 12. Okay, that's good to know. Hi, Paula, Andrea Baez from your office. Your
Oh,
staff is
hi.
watching and saying hi. Hi, everybody. Sorry I'm not there. Chelsea has a question, Chelsea Wang. I love hearing any new exciting therapies for treating a port wine stain. Is there anything new with the genetic pathway identified for the port wine stain?
There's no specific targeted treatment as yet, but once genes are identified, it is exciting because it does open the door for that possibility, but not as yet.
Right. Thank you for that. And by the way, those of you with a port wine, whether it's you or your child, Dr. Comey, who's the leading Sturge-Weber expert, she and I just came up with a new graphic. We're calling it the yellow mask zone. So around the orbit, the temples, and the forehead up to the hairline, if the stain is in that area, regardless of what you've been told previously, it is in the risk for Sturge-Weber syndrome, and you do still need to get eyes checked. And if there's never been an MRI done, that needs to be done. I know there is a lot of misinformation on this, so I just can't emphasize it enough that if the stain is from the lower eyelid up to the hairline, temples, to please see someone who is a Sturge-Weber syndrome expert and get an evaluation done. Because again, and I'm sure you hear it all the time, Dr. Duarte, where they come and see you at 4 and 5 and we're told, oh, it's not a problem, and then you have to refer them.
Yeah, so really important what Linda said is to consider Sturge-Weber when you have involvement of the upper and lower eyelid, and of course up into the forehead. The larger ones are really easy to identify. It's those smaller ones that maybe just include a little bit of the lower eyelid along with the upper eyelid. And those Dr. Comey has published on, those are just as important to work up. So it's extremely important to look at maybe following along with an ophthalmologist, a neurologist. And a point that Dr. Comey makes is that oftentimes the MRI is done too early. So we definitely don't want to do an MRI early if there's no signs of seizures, because the ideal time to do the MRI so that you only have to do one is at age 1 year. So that's an important time to remember. And only do it earlier if there are suspicious behaviors that would indicate possibly a seizure is going on.
Okay, so if everything seems normal, you can wait till 1, and that's another thing Dr. Comey explains when we do our Facebook Live, the little things like the baby's eyes and the fisting that you have to watch for. New parents don't know what to look for, even for something like a minor seizure. And that's why VBF created these fact booklets. This morning when I was doing the lecture for Grand Rounds, I pulled up this one, which is the one that you co-authored with other experts, Dr. Duarte. This is the hemangioma infantile booklet. And this is all the frequently asked questions in it. And these booklets and the port wine stain ones are really important because of the misinformation that's out there, unfortunately. And I'm sorry that it has to keep being out there. One of the moms.
So can I just interject something? Because thinking back on the question that I was asked, it's not exactly the question I was asked, but one of the genes that has been identified with some of these malformations is the PIK3CA gene. And for that, there has been an advance within the PIK3CA or the PIK3CA related overgrowth syndromes. So while we're doing a lot to improve the actual capillary malformation with, whether it's PDT coming up maybe in the future and the new V-Beam Pro, the overgrowth would not be improved with either of those modalities. So what we have found in the last couple of years is the PIK3CA gene involvement for things like the Klippel-Trenaunay, which is on the spectrum of the PROS syndromes. There are some Sturge-Webers that if you notice, if they involve the lower third of the face and you get that overgrowth, there are some that are responding to this medicine called alpelisib, which is the one that inhibits the PIK3CA gene. So it's important to keep that in mind and bring that up with your physician. You can get the genetic testing, but even if your child or yourself are experiencing any overgrowth, you don't necessarily have to have the gene. you can be treated with this medicine just based on the clinical presentation of overgrowth. So that is one important advance in terms of the overgrowth that sometimes we forget about, and we're treating the port wine. And then when the kids get into maybe puberty, you start to see some of that overgrowth, whether it be an extremity or the jaw, the lips. So just to keep that in mind, super important.
And also, before my mentor and hero, Dr. Mim, passed away, we had collected, and Dr. Weiner was a part of this study, 40 cases of lip overgrowth because I had suspected it was a PIK3CA mutation, but that pathology, we hadn't been looking for that in the overgrown lips. And Dr. Mim was not only seeing what he would confirm to be PIK3CA, but he saw something very interesting in the lower lips. You know what he saw, Dr. Duarte? He saw hyperplasia that he had only also seen in an infantile hemangioma, and he couldn't explain that.
Interesting.
But he said it was almost eerie how it looked like a hyperplastic hemangioma instead of a hypertrophic. So that was like just a couple months before. And I don't know if Dr. Weiner is continuing that PIK3CA study, but there's so much more for us to learn.
Yeah, a lot more is being published on it, definitely.
Yes. So Nikki has a question for you. Hi, Nikki. Nikki Miller from Down Under. Hello from Down
Yay.
Under. One of the places I've never been that I want to go to is Australia. I'm sure you've been there, Dr. Duarte, right?
I have.
Yep. So Nikki says, my daughter Carly is a 26-year-old Sturge-Weber syndrome warrior. She had a hemispherectomy in 2015 and was seizure-free until 2023. She had an onset and diagnosis of encephalitis and hydrocephalus. Update now, although we have some additional setbacks, she's back working, and we as a family just keep taking each day as it comes. We have noticed her port wine seems to be darker, but no overgrowth. Thanks so much for these lives, as it really gives us families some great information. Appreciate your expertise.
Thank you.
I mean, so that's a lot, that, and I will say something. I want to say something about this. 5 years ago, you rarely heard of hemispherectomies, but they're now like more and more, and shockingly how these babies adapt after these surgeries and they do so well. It really is amazing to me. It really is amazing. And Dr. Comey's got a lot of studies going on, so hopefully there'll be some new things. And I'm sorry, Nikki, that she's had this recurrence. And, I hope everything works out and that she can get this under control. But thank you for sharing that. And I see so many of you on. Let us know what country you're from. Let us know what your questions are. A couple of you have said you've submitted questions, but I'm not seeing them in my feed. Kiana, if you're seeing questions that I'm not seeing or I'm not answering, please repost them so I can see them. So Dr. Duarte does do this free laser clinic and conference every year. It's been in February for the last couple years, and tomorrow is the free laser clinic. So I think we sent over, as of yesterday, 15 patients.
Yeah.
So it's a good crowd. I'll miss my little babies that I like to see all the time. So you'll have to have one of Sergey, or you will be Dr. Linda, fussing over the little babies like I love to
Of
do.
course.
Sergey's so good with the kids anyways.
We'll bring you in live.
Oh
We'll
yeah.
bring you in.
Yeah, I asked you or Lily or Sergey to just bring me in so I can say hi
Yeah.
and see them. That'd be great.
We can set you up in the waiting room in the computer screen.
Oh yeah, that is great. And send them to talk to me. I would love that. That'd be great. That'll be awesome. Um, So Debbie wants to know, what can I expect tomorrow? Anything I can do to prepare? I haven't had a laser treatment and I'm curious, how far has this technology come? Oh,
When was your last treatment?
over 10 years ago.
So it hasn't really changed too much. Most likely you were treated with a V-beam perfecta. It has a little cooling device on it, so it's going to really reduce the pain significantly. There's always a little anxiety that goes along with having any procedure. To prepare, I would definitely maybe take some Tylenol about 30 minutes before your procedure. Definitely not anything like an Advil that could, cause more bleeding and more bruising. It should be okay. There's really not too much prep. We'll have some sunscreen so you can wear it out of the office. If you want to bring a hat so that, you just want to protect the area from getting any sun. That's really pretty much it. It's a really great and easy procedure. You might have a little tiny bit of swelling, especially if we put a shield in to do around the eye because that area tends to swell a little bit more. Um, that's pretty much it. It's good. You'll be
It's pretty
fine.
quick. I can tell you it's over before
Yeah,
you can blink.
yeah.
Katya says, can you do laser on a lip hemangioma in a baby?
You can. Yeah, you can. There is a risk depending on how young the baby is. I don't know exactly, age-wise when you'd say baby. But the thing with hemangiomas on the lip is any hemangioma, the most common side effect or the most common complication is ulceration. So the laser can trigger that. And so I'm very cautious with treating hemangiomas while babies are still requiring to suck off a bottle or nursing, because if they get a little erosion on the lip, it becomes very painful and then they have a problem feeding. And in my own experience, I had one patient that needed to be admitted and it became a problem. So I don't think, unless there's a real need, I back off of that until the children are out of that nursing bottle feeding phase. Definitely off a pacifier.
Okay, thank you
So
for
the
that.
answer is yes, but I don't always recommend it.
Okay. So Afton has a question. Hello from Minnesota. We're traveling to New York to receive a laser treatment for my son's port wine on his face. The doctors in Minnesota will not laser around the eyes before the age of 3. Do you know why some doctors are not willing to raise laser around the eye? I know I do, but go ahead.
So I'm also a bit selective, and there is a spectrum of comfort with inserting an eye shield in a smaller child. So if the parents want it, I will do it and I can do it. My concern is when you insert this shield in smaller children, you need to put in numbing drops. So the numbing drops are going to make the eye numb, and the child can inadvertently scratch their cornea and may not be aware of it. And then a few hours later is going to be screaming in pain. Especially if you're treating around the eye, the children are going to want to grab at their eye. And, just for that reason, I personally tend to wait until I go to the OR. So I do a lot of treatments in my office, but I also do some treatments in the operating room. So that's just my personal algorithm. But will I do place a shield in the office in a younger child? Yes, but that could be the concern with the dermatologist in Minnesota, is that they're concerned also that it's a bit of a struggle. So there could be an issue where you scratch the cornea. Now, I've seen Dr. Geronimus put these shields in all the time with zero problems. So there's a whole spectrum, and it really depends on the level of comfort of the person doing it.
I
So
think that's a
this is,
really good way of explaining it,
yeah.
yeah. Um, an interesting fact is one of my moms who brings her daughter for laser, and Dr. Geronimus puts the shield in and lasers around the orbit. And then she goes and sees the pediatric ophthalmologist for the glaucoma. And the doctor discovered it gets artificially inflated, the pressure, because of the shield being on the eye. So she now has to wait and get it done like a day later. And I think that's something that we should add to the like laser guidelines, is to be aware that when you put the ocular shield on, you actually can be increasing ocular pressure.
You are. In fact, the other day I personally learned that myself because I wear contact lenses and they measured my pressure right when I took my lens off. And it was like, hey, wait, why is this a little bit high? And then they waited a little while and it settled down. And it was because of the contact lens.
Yeah,
So
but
anything puts that pressure there.
yeah, and it's something we just never thought of. And, there are a lot of families that go right from the laser doctor to the eye doctor. So I'm like, we need to let people know about this. So Carrie says, my 3-year-old grandson was the side of his face. He must have a port wine on the side of his face. No treatment. Is laser appropriate? It seems darker to me. I'm not sure, Carrie Frederick. What are you talking about, a port wine? Because you're saying possible embolization. Is it a venous malformation, arterial venous? If you can just write back, Carrie, and let us know what it is. Another woman, Hannah, said, does cavernoma of the brain, can this be treated? Cavernoma of the brain? I have not heard of
Um,
a cavernoma.
I know of a sinus pericranii. I'm not sure of this diagnosis. But most everything will have some treatment. That's way outside of my scope, but yeah.
The intracranial lesions are usually something that, Dr. Berenstein at the INN in New York City or neurointerventional radiologists will treat, right? With usually embolization or some
Yeah. You
unique,
need a really good interventional
right?
neurointerventionist, neuroradiology intervention. But most likely we'll have some treatment, yes.
So she also wanted to know, is the laser only good for surface vascular lesions?
Right, so the laser really only penetrates a couple millimeters into the skin. I think even with the Pro, we might get down maybe another millimeter, but it's very superficial. That's why I think it's really important if there is some overgrowth to think about the PIK3CA inhibitor, the alpelisib, for that. But the laser is quite effective in treating the superficial aspect. It does require multiple treatments. Right now, we're not at a point where we can effectively cure these. And even in patients that we get 95, 97% clearance or even 100% clearance, after about 3 years, you might start to see the footprint or the shadow of the lesion come back. What we tell parents in general is that it's going to improve. The frequency is going to be a smaller interval. In fact, as low as 2 weeks. The done by one campaign is every 2 weeks for the first year. And then my algorithm is more about on a every 4 week basis. There are some insurances, Linda, that are giving us a lot of trouble. They only want to treat every 90 days.
Ugh,
So that's something we need to look at.
yeah, I
So
just,
that isn't,
yeah, go
but
ahead.
it's tough. So we do have to have multiple treatments. And then what happens is after a year and after you get significant clearance, maybe 80% to 90% clearance, then you just start lengthening the interval. Then is when really I think it makes sense to go every 90 days or even every 120 days. But I feel like, unfortunately now, the insurance carriers, they are something we have to deal with. And right now, a lot of them are really saying no every 90 days
That's
because that's the
exactly,
global stop
yeah,
that
that
was
was,
assigned to.
yeah, that was an email I got this morning, was a mom who was enrolled in the weekly program and they're only paying for one. So she's paying cash for the other 3 a month to get 4 in a month. So that's
She's
unfortunate.
lucky that she can get the monthly. In Florida now, seeing a lot more that are going every 90.
Well, that'll probably happen with us too. So Christian says he has a 9-year-old child with a port wine stain currently undergoing private laser treatment in Romania, likely with the V-beam. I believe it is the V-beam. Dr. Duarte, do you prefer laser on the lip? What about the eyelid? What happens to the port? Like, she's got a couple questions. So do you perform laser on the lip?
Yeah, you can treat the lip. Again, in the very small children that are still sucking, needing bottles or nursing, I try to hold back on that until they're out of that stage, but definitely on the older children you can. But the laser is not going to treat any overgrowth of the lip. That's something that either they may qualify for alpelisib or it could be a plastic surgical lip reduction. If you're looking at the laser reducing the thickening of the lip, it won't do that. It's also really important. I know Linda always has a dentist that's part of the clinic in New York because a lot of time these patients that have the lip lesions will have gum involvement and they really need meticulous dental hygiene as well. We don't tend to treat the mucosa of the if it's affected.
She also wants to know, I guess I don't know the answer to this, but I've seen a lot of port wine stains that can cover like 3/4 of the baby's scalp. And she wants to
Mhm.
know over time, what happens to that? Do they thicken and develop any texture changes, or do they just stay flat?
So I've seen them thicken, but in general, most of the laser surgeons I know do not treat inside the hairline because while it's not a laser hair removal system, there can be some stunting of the hair growth to a point where it can take 6 to 8 months to recover. And, parents in general get very apprehensive about that, which is one of the reasons the eyebrow is sometimes not treated because it can stunt the growth, even though it will recover. So generally the scalp though, we don't treat, but it can grow some. And certainly if you develop little pyogenic granulomas or these little like vascular cobblestoning, those can be removed surgically and addressed individually rather than blanket treat the scalp. I don't know anybody that really does that or recommends that.
Agreed. She's asked a couple questions to me. What laser will be used in Romania? It's not September. We are currently discussing a clinic in Bucharest in November, not September, November. And they use the V-beam. I'm not sure what doctors from the US will be coming yet. There's all this new licensing requirement now for doctors from the US that are traveling to other countries, even with Operation Smile and Doctors Without Borders. That's why we just had to
Wow.
cancel. We just had to cancel our UK clinic with over 90 patients because it's a 1-year wait process for physicians from outside the UK to get approval to even see a patient in the UK. And they wanted every device registered, so they really kind of prevented us from coming. And I know there's a Dr. Leah Solman is the one I know of that's in London that treats children and adults with port wine stains. The next question is for you, and it is Carly was 17 when she had her hemispherectomy. Oh, miraculously no side effects. She is defying odds and able to use her affected side. Bravo. Amazing. It's given patients. They're she's fine with motor skills. I just wanted to give others some hope. Thank you for sharing that. That's very important. Chelsea Wang says, hello, Dr. Duarte. I wanted to hear about your experience in treating non-facial chest, neck, and arm port wines in infants. We are treating aggressively, but she's 5.5 months old and 10 sessions, but it's very much there. Lighter in some areas, but still pretty dark. Should we stop? Should we keep at it? She's
Are
5.
you, well, yeah, if you're able to do it in the office setting, there is a 12 millimeter spot size. You can ask your laser surgeon. I'm not sure the parameters that are being used. These can be adjusted quite a bit, as I mentioned earlier, the energy, the pulse duration, and also the spot size. So there is a 12 millimeter spot size where you can cover quite a bit of area faster. And that's the spot size that I tend to use on these larger lesions. It also penetrates a little more deeply because of the larger spot size. There's a little more energy drive into the tissue. So you can check that, but I would try to push through as much as you can, get as much done. because the surface area is smaller, even though it is a lot for a 5.5-month-old, it should be relatively quick, especially if they're using a 12 mm spot. So that's what I would ask. And I would try to push through a little bit.
Now, this next question, she wants to know, and you and I did these little bookmarks that are all the approved for sun facts when you have a port wine. And her question is really cute. It's like, Dear Dr. Duarte, is the sun really an enemy of the port wine stain? I'm always concerned being in the sun without a hat or sunscreen.
So it's only an enemy of the port wine stain in as much it's an enemy of the skin in general, because you will have a risk of skin cancer. But it's definitely an enemy of the laser. So if you are doing port wine stain laser treatments, you definitely want to stay out of the sun because that melanin that's going to get deposited is going to block the laser light from getting to the blood vessel where it needs to go. When you look at, I don't have a screen to share, but when you look at the melanin light absorption and the hemoglobin light absorption, the oxygenated hemoglobin light absorption, which is what the laser is targeting, there it will block it if the melanin is very dense. So we want you to have as little melanin in the skin as possible. And that's one of the challenges that we have when we're treating patients that are more darkly pigmented is getting the laser through to where it needs to get through. You have a higher risk of getting a burn from the laser. Remember, the laser is putting energy in the skin. It needs to deliver it where the target that's intended for. If it goes too high in the skin, it can actually cause some blistering. So that's the reason you want to sun protect as much as possible when you're on laser treatment.
Thank you. That was great. Katya then wants to know, Dr. Duarte, what's the best treatment for a lip hemangioma for a 3-month baby? It's growing slowly and it hasn't ulcerated, or should we just keep an eye on it?
So lip hemangiomas, especially if it's growing slowly and is only 3 months old, can definitely continue to grow until the baby is a year and a half. So I feel like this is an area that is one of those vital areas that should be treated with hemangiol, the oral propranolol, and try to reduce the size of that and keep it from growing. If you wait too long to start hemangiol, which has been found to be safe and effective, what happens is the blood vessels that are in the hemangioma start to be replaced with fat cells. That's called a fibrofatty change, and then that's not responsive to the medication. We want to treat with hemangiol after age 1 month corrected age. So if you're a little ex-preemie, that's why I mean corrected age. So whenever you're supposed to be born, if you're full term, it's at 1 month of age. If you're premature, it's whatever your targeted date was 1 month later. That's what I would recommend if you were my patient is to go ahead and get started now. There's still a good window. You're at the end of the optimal time, but there's still time. I like to treat before 6 months. Ideally, these kind of lesions I like to start at age 1 month.
Thank you for that. Oh, Carrie, who had written to us before, it is a venous malformation on her 3-year-old grandson. Of course, we don't have images or photos to look at. She just wants to know, is there a role for laser with a venous malformation?
So laser is extremely secondary for a venous malformation. This is where you want to work together with your interventional radiologist and even in some cases plastic surgery. If the venous malformation is having overgrowth, this is also a time where we want to also possibly engage with our hematologist and make sure that there's no consumption coagulopathy or anything like that. They check something called D-dimers. So it's really a collaborative effort. And if you missed the introduction, I'm the chief of the International Birthmarks Institute at Nicklaus Children's Hospital. And some of these lesions really require a network of physicians. So dermatologist, plastic surgeon, interventional radiologist, we all work together, hematologists, to make sure that treatment is optimized for the patient. Now, there are some cases where if the lesion extends very much into the skin, that the interventional radiologist will ask me to laser so that we can cut down on any kind of skin necrosis that could occur from the injection of the material that would be injected. You know, sometimes they use bleomycin. There's different things that they use. So there is some role for laser, but it's really secondary. So we are part of the team, but not necessarily the most important part. And of course, all these lesions are different. So definitely pictures help tremendously. But find yourself a hospital that has a vascular birthmarks team or vascular anomalies clinic. That's your best bet.
Good. And Tuesday has a question. She's from the UK. This is a good question. Her almost 2-year-old has a pretty extensive infantile hemangioma covering a large part of his hand, the palm, the fingers, and they've treated for 4 months very successfully with the beta blockers since December. And they said it's dramatically improved, but that there's still a large amount of puffiness and loose skin and a fair amount of color. The dermatologist wants them to go to the Great Ormond Street Hospital for further management, but only because she's pushed and used for the fact that it covers his whole hand. It's the palm in his hand, and he's therefore very likely to repeatedly injure it when he's growing up. She's wondering if you have any advice for navigating the next stage of her journey and what would be best to advocate with for her son, because it is still puffy and it's still got quite a bit of color left.
So I usually treat until age 1.5. Did we get an age on the child?
2 years old
Two
now.
years old.
And he
Okay,
went
so
off of it in December. He went off the medication.
Okay, so again, pictures worth 1,000 words here, but there
Yeah.
are a lot of, so one thing, over the next 10 years, this is going to recontour and reabsorb on its own. So this treatment is to expedite that. So over the next 10 years, this is going to continue to remodel. So you have that. We also are using some radio frequency microneedling devices that put heat and little microneedles into the skin to tighten up, because most likely what's left there is what I mentioned earlier, that fibrofatty change. The loose skin, the body tends to absorb this. We know people that maybe lose a lot of weight, or even after pregnancy, right? Everything kind of comes back into place, at least a lot of it, right? Maybe not 100%, but 95%, right? So a lot of that is going to improve on its own over time if you're patient with that. And also there's the radio frequency microneedling. Happy to look at a picture so I could really guide you further. The laser can be helpful for any residual color. If it's a superficial component, we often use these in addition. And I'm not too worried about injuries and things like that in general. As long as the manual dexterity is good, um, that there's no need for any occupational therapy or any kind of physical therapy, this should continue to improve.
Thank you for that. This next question, I get it all the time. I don't know if you have a way of answering it, because I don't. But Afton wants to know how many average number of laser treatments are required to reach 90 to 95% clearance if the child is under age 1.
So that is a question that I don't think anyone can
Oh,
answer,
I
because
don't think
every
so.
child is different. You have to understand that while the port wine stains can look similar, their depth, their thickness is different. The flow of blood through them is different. Some are faster flow, slower flow. The diameter of the capillaries is different. So all of this is going to affect resolution. Um, Faster flow lesions are not going to respond as well, right? So there are some where the laser just is perfect. It hits the sweet spot of the lesion, so to speak, and you can literally erase it, but that is really the exception, not the rule. So we tell patients after 6 treatments, we can guide them, but there's patients that have had 20 treatments. There's patients, if you did the every 2 weeks for the first year, just add that up, right? Over 100 treatments. And then, as I mentioned earlier, even if you get 85 to 90% clearance, you can get some recurrence a year, a year, 2 years later. And then what happens is the treatment interval is going to be spread out. Now, with the photodynamic therapy, they are getting more persistent improvements. So, I mean, there are things that may come our way that are going to be more permanent, but we're not at that point yet.
True.
So
Juliana,
we don't have We don't have a number.
Yeah, there is no number. So Juliana says hello from Norway, and she said
Hi.
daughter has a capillary malformation, or they think it is, across the jaw and neck. They've met with 3 different dermatologists, and there's uncertainty over the diagnosis because they're not sure if it's a permanent birthmark or a temporary one. So with that language, I'm assuming they're not sure if it's some kind of a superficial hemangioma or if it's a port wine. But she wants
Right.
to know in either event, should we proceed with laser?
How old is the patient again?
Um, she doesn't say. Yeah, she doesn't.
Right. So again, like Linda mentioned, if there's a doubt in terms of the diagnosis, laser, it can help superficial hemangiomas, and it can definitely help the superficial aspect of a capillary malformation. For capillary malformations, we definitely want to treat as early as possible. We want to start treatment immediately, literally from the nursery. We have good results. We have literature to support doing that, and to have a small or a small time interval between treatments. So even as short as 2 weeks. Infantile hemangiomas, though, you have to be careful because you can trigger some ulcerations with very aggressive treatment. So you want to go easier on those. But the laser can be helpful for both. And again, we're making assumptions based on something that's written. If you want to send us a picture later, we can share my email and we'll be happy to get back to you.
Yep. And we do have your email, so we can share that. Monica lives in Florida, and she said, hi, Dr. Duarte and Dr. Linda, and wants to know if you treat KTS.
So we do treat it as a team. Remember, this is a group effort, and KTS, right now we have the PIK3CA related overgrowth syndrome. It's part of that spectrum. We have the medicine alpelisib, which has been renamed for overgrowth V-Joyce. And so our hematologist that's on our team, Dr. Khatib, he actually manages the alpelisib administration and the workup for it. It's a very, very safe medication, but there is some workup that we need to do just to start it. We also work together with our colleagues in orthopedics, with our colleagues in interventional radiology. So it's a group effort, and certainly I can do some laser treatment of the superficial aspect if that is indeed part of, the treatment that you want. But again, it's a group effort. We have to evaluate. It's very important though with KT to get evaluated for alpelisib because it's really changing the quality of life of a lot of patients, especially if you're suffering from pain. It diminishes the pain very quickly. And also the overgrowth. It's a little bit of a miracle drug. So all that tissue comes down. And also to check and make sure your coagulations are good. That's very important because you have a higher risk of getting any clotting.
Thank you for that. And we're getting down to the wire, but we have a couple more questions, and we had a little bump with trying to start. So I'd like to get those questions
Yeah.
answered by you. Melanie has a 1-year-old who has a huge congenital hemangioma on his foot, and Cincinnati Children's Hospital wants to do surgery in the future. It sounds like a niche because she's saying he's 1 and there's absolutely no shrinkage of it. She wants to know, is there any negatives to having the surgery?
So just to be really clear, there's congenital. That means you're born with it fully formed. That's very important. If there's any doubt of the diagnosis, it's important to take a little biopsy because these will be GLUT1 negative, GLUT1 negative. So you could ask about that if that's necessary. If the diagnosis is not in any way in question, you need to have imaging, whether you have ultrasounds, MRIs before any surgery, because some of these can be addressed with interventional radiology. Because depending on how big this is, the foot is a vital structure, right? And it is,
Right.
scars on the feet can be very painful, and we don't want to create a quality of life issue in terms of ambulation. So I would just make sure you're in a place that has a team that can look at this from different perspectives and see what the best treatment plan would be for your child.
Thank you for that. Marina has an interesting question. She doesn't say how old her child is or where the lesion is. She just said her daughter had an MRI with contrast, and she wanted to know the difference between the MRI and the MRA. She said the results came back clear, no malformation noted, but I'm reading that MRA is more accurate in identifying vascular malformations.
Yeah, if there's a concern, you do need to get an MRI with and without contrast and an MRA. The MRA is going to look at the vessels. That's going to give us that anatomy of the vessels. So that is important. If that has not been done, and there is a concern about any kind of venous or arteriovenous malformation, even a lymphatic malformation, I would definitely recommend that that be done.
A couple more questions before we go, and thank you for staying to answer these final questions. Zoe wants to know her 9-month-old daughter was born with a birthmark all over her body except her face. They say it might be CMTC, but she also just got diagnosed with overgrowth. And she also has port wine on her shoulder, down her arm. Should we be doing laser treatment or testing, genetic testing?
Yeah, absolutely. Get genetic testing. There's also the CM, AVM diagnosis, which is capillary malformation with arteriovenous malformation. Some of these children will need full body MRIs, MRAs to make sure there's no hidden arteriovenous malformation. There's also the CM where you have like overgrowth of or hydrocephalus associated. So we want to make sure that there's no syndrome associated with this extensive malformation. CMTC could be part of it. That's where you have a cutis marmorata or a net-like pattern to the malformation. Sounds like a complex malformation. This is another case where it's really important to be in a center that has a vascular anomalies team to really address this lesion from a lot of different perspectives. So there's so much genes that have been identified with these. It's important to get genetic testing and a lot of imaging, I'm sure. Laser, of course, is part of the treatment, but it's not everything. So if you have a team, that's going to be your best bet for an overall improved outcome.
So the last question is, could you please give an email where there's a couple people who want to send you a photo or a question, and they would like to know what email to use?
Yeah, you have it, right? The pddermdoc@aol.com.
Yep,
Yeah,
yep,
PEDIDERMDOC@aol.com.
yep. I'm putting that
But
in.
I really can't emphasize how important it is to, especially if you have a more complicated lesion, to be in a center that has a vascular anomalies team. And there are a lot across the country. And I can also help you find one if you want to email me and try to set you up with someone near you. A university, most of the university centers will have that.
And also on our website, if you go to birthmark.org, up at the top where
Of
it says
course.
find a doctor, you can find them. But as Dr. Duarte is saying, there's individual experts and they are very good and they can handle a good 75%. But then there are true multidisciplinary teams, just like there are at Nicklaus, where you have the radiologist and the hematologist that work together comprehensively. Not every area has the team, but you can go on our website and see where the teams are and the individual experts. And you can also write to Dr. Duarte and she can let you know. So
Absolutely.
thank you so much, Dr. Duarte. It's been a great session. Thank you so much for your time. And we look forward to doing our live session with you again next year. So thank you very much. And I
I'll
hope
see you
that,
tomorrow.
yes, yes, we'll see you tomorrow when I'm on Zoom again, being zoomed in to say hi to everyone. So thank you.
All right. Bye, everyone.
Thank you. Thank you.
Bye. Thank you, Linda.